He is 70 years old. He walked into my office, sat down, and crossed one leg fully over the other without using his hands. Most of my patients his age cannot do that. I asked him the standard questions. Any morning stiffness? No. Any pain going downstairs? No. Any aching in the hands when the weather turns? He looked at me and said, "Doctor, I don't think I have ever had joint pain in my life." Now, I want to be honest with you before I go any further. Some of that is luck. Genetics matter. Old injuries matter. If you tore a meniscus at 25, your knee is on a different path, and no food is going to undo that. So I am not going to stand here and tell you that this man's breakfast is the reason he is pain-free. But when I asked him what he eats, I recognized almost every item on the list, because they are the same foods that keep appearing in the research. 6 of them. He eats them nearly every single day. And I am going to tell you exactly what each one does inside the joint. I am also going to tell you which one you must not take if you are on certain medications. That last part matters, so please stay with me to the end. First, let me explain what we are actually protecting. Inside your knee, the ends of the bones are capped with cartilage. Cartilage is a remarkable tissue. It is slicker than ice, and it has no blood supply of its own. It survives on fluid that gets squeezed in and out every time you move the joint. Osteoarthritis happens when enzymes begin breaking that cartilage down faster than the body can maintain it. Those enzymes are switched on by inflammation and by mechanical load. So everything that follows targets one of those two things. Number one is fatty fish. Salmon, sardines, mackerel, herring. He eats fish 2 or 3 times a week and takes no supplement at all. Here is the biology. The fats in your cell membranes are the raw material your body uses to build inflammatory signals. When those membranes are loaded with omega-6 fats, your body produces more of the compounds that drive pain and swelling. When they carry more omega-3 fats, it produces fewer. You are literally changing the starting material. A meta-analysis of 10 randomized controlled trials found that omega-3 supplementation meaningfully reduced how many anti-inflammatory drugs rheumatoid arthritis patients needed to take. That is a real finding, and it is held up across more than 20 years of trials. Now, I have to be straight with you about something. A recent systematic review found the pain benefit was clear for rheumatoid arthritis, for migraine, and for several chronic pain conditions. But it was not clearly demonstrated for osteoarthritis. Those are 2 different diseases with 2 different mechanisms. Rheumatoid arthritis is your immune system attacking the joint lining. Osteoarthritis is cartilage wearing down. Omega-3s have stronger evidence in the first than the second. I would rather tell you that plainly than oversell it. Number 2 is dark leafy greens. Kale, spinach, collard greens, Swiss chard. And this one surprised me when I first read the research. Most people think of vitamin K as the clotting vitamin, but there are vitamin K dependent proteins sitting inside your cartilage. One of them is called matrix GLA protein, and its job is to stop calcium from depositing where it does not belong. If you are short on vitamin K, that protein cannot do its job properly. Researchers in the multi-center osteoarthritis study followed 1,180 adults with an average age of 62. They measured vitamin K levels in the blood at the start. 30 months later, they scanned the knees. The participants with low vitamin K had a 56% higher risk of developing new knee osteoarthritis on X-ray. They were also more than twice as likely to develop new cartilage damage on MRI. Now, a note on absorption. Vitamin K is fat soluble. If you eat a plain salad with no fat, you absorb far less of it. Add olive oil or avocado or a few nuts, and your absorption improves substantially. Number 3 is broccoli. And I want to label this one carefully because the evidence here is still early. When you chew broccoli, cabbage, or Brussels sprouts, a compound called sulforaphane is released. Researchers at the University of East Anglia showed that sulforaphane blocks the specific enzymes that chew through cartilage. Mice fed a sulforaphane-rich diet developed significantly less cartilage damage. Then they did something clever. They recruited 40 patients who were already scheduled for knee replacement surgery and fed them broccoli beforehand. When the joint came out, they tested it. The sulforaphane had reached the inside of the knee. That matters because plenty of promising compounds never get where they need to go. But I want to be clear, the human trials on pain relief are still small and still preliminary. This is a promising signal, not a proven treatment. If this is useful to you, tell me in the comments what you are already eating from this list. I read them. Number 4 is fiber, and this is the one nobody expects. Beans, lentils, oats, barley, whole grains, and vegetables. In 2017, researchers published a study in the Annals of the Rheumatic Diseases, drawing on 2 large American cohorts. More than 4,000 participants in the Osteoarthritis Initiative were tracked for 4 years. Those eating the most fiber had roughly a 30% lower risk of developing painful knee osteoarthritis. Higher fiber intake was also linked to a lower risk of knee pain getting worse over time. Why would fiber affect a knee? 3 reasons. Fiber helps regulate body weight, and I will come back to weight shortly. Fiber lowers systemic inflammation measured by markers like C-reactive protein. And fiber feeds the bacteria in your colon that produce short-chain fatty acids, which have anti-inflammatory effects throughout the body. Your joints are downstream of your gut. Now, here's the number that concerns me. The average intake in those studies was about 15 to 19 grams a day. Most American adults get less than that. The recommended intake is roughly 25 to 30 grams. And if you are going to increase your fiber, please increase it slowly over 2 to 3 weeks. And drink more water or you will be uncomfortable. Number 5 is turmeric. And this is the one with the most impressive clinical trial behind it. In 2019, researchers randomized 139 patients with knee osteoarthritis. Half received curcumin, which is the active compound in turmeric. Half received diclofenac, a prescription anti-inflammatory drug. After 28 days, the pain relief was statistically similar between the 2 groups, but the side effects were not. 13% of the curcumin group reported adverse effects compared with 38% in the diclofenac group. And this detail stayed with me. Not one patient in the curcumin group needed an acid-reducing medication for stomach protection. In the diclofenac group, 28% did. An earlier trial found curcumin performed comparably to ibuprofen for knee osteoarthritis as well. 2 practical notes. Curcumin is poorly absorbed on its own. Black pepper contains piperine, which increases absorption substantially. And fat helps as well. This is why traditional Indian cooking has combined turmeric, black pepper, and oil for centuries. They worked it out long before we ran the trials. But now I need you to listen to me very carefully, because this is the part I promised you. Curcumin in concentrated doses can increase bleeding risk. Fish oil can as well. And vitamin K directly interferes with warfarin, which is sold as Coumadin. If you are taking warfarin, a sudden large increase in leafy greens can change how your medication works. That does not mean you cannot eat greens. It means you should keep your intake steady and consistent, and tell your doctor before you change it. If you take warfarin, a blood thinner, or an antiplatelet drug, or if you have surgery scheduled, please speak with your physician or pharmacist before adding concentrated turmeric or fish oil supplements. I am not saying that to be cautious for its own sake. I have seen the consequences. Now, the sixth thing on his list is not a food at all. It is what he does not carry. He is not thin, he is not an athlete, but he has stayed within a stable, moderate weight range for 40 years. And here is the research that changed how I explain this to patients. Dr. Stephen Messier at Wake Forest studied older adults with knee osteoarthritis and measured the actual forces inside the knee during walking. He found that every single pound of body weight lost removed about 4 pounds of load from the knee with each step. Not 1 pound, 4. Now multiply that across a day. He calculated that losing 10 pounds means each knee absorbs roughly 48,000 pounds less compressive load per mile walked. 48,000 pounds per mile. That is why weight is not a lecture about appearance. It is arithmetic about load. And it is why fiber and whole foods matter twice over. They reduce inflammation and they help regulate weight. And both roads lead to the same joint. Before I let you go, 4 honest statements. One patient is not evidence, and I would never present him as such. Several of these findings are observational, which means they show association and cannot prove cause. Food does not repair cartilage that is already gone, and I am not going to pretend otherwise. And if you already have significant arthritis, diet is one tool among several, alongside strength training, physical therapy, and treatments your doctor may recommend. This video is education, not medical advice. I am a physician, but I am not your physician. Please talk to your own doctor before changing your diet or your supplements, particularly if you take blood thinners. But here's what I keep coming back to. Cartilage has no blood supply. It is fed by movement, and it is protected by what you eat. Those are 2 of the few things still under your control at 70, at 80, at 90. My patient did not do anything exotic. Fish, greens, broccoli, beans, turmeric, and a steady weight. That is the entire list. Tell me in the comments which of the 6 you already eat and which one you're going to add this week. Take care of yourselves, and I will see you in the next one.